Today let's talk about the enlarged ovaries. There are two images of the enlarged ovaries. Here we can see this ovary is the right ovary, this is the left ovary, and whatever the follicles you can see now, it is arranged as if this is a string and the pearl. How the pearls are arranged in the strings, it looks like that, and the follicle size are also smaller. Here we can see this is one ovary, this is a second ovary, that is ovary size is also increased and the follicle size is also increased. This is bigger compared to this image. This follicles are bigger. So what is the diagnosis? When there is a string of pearl appearance, it is PCOD. What is PCOD? It's a polycystic ovarian disorder. So, how do we diagnose this polycystic ovarian disorder? This is based on the criteria called as the Rotterdam criteria. In this Rotterdam criteria, we do the diagnosis based on the clinical features, based on the biochemical features and the radiological features. If any two of this diagnosis is positive or tells us about this is near the PCOD diagnosis, then we can tell it as the PCOD positive. What are those features? First clinical feature, if the patient comes with a history of the amenorrhea or if there is the history of the irregular cycles. So if there is a woman in a reproductive age group comes with an history that she has irregular cycles 30 days or 50 days once, we have to think once about the PCOD. Second, infertility. Because in PCOD there is no proper ovulation happening and anovulation is most common and the infertility is one of the main reason. PCOD is the main reason for the infertility. Third feature, we can see the most appreciating feature is the hirsutism. That is, we can see the facial hair. Facial hair growth can be seen. Next is a biochemical features. If we have when you check the FSH and the LH, the levels of these two is increase in the PCOD. Then when you do on the USG, you can see the follicle size is usually increased, like it is be increased to the size of about 20 mm or it will be equal. The size can be around 10 mm also. The most specific feature is that there is the hyperechoic. So the echogenicity of these follicles will increase. Okay, will increase. So how do we treat this condition? So any three of this should be positive to tell it is PCOD. So now for the treatment, how do we treat it once we diagnose that it is PCOD? If there is irregular cycles, we have to give the combined oral contraceptive pills. What are those? That is non-ethesterone plus ethyl estradiol can be given. These, how to take the combined pills is, we have to take that for 21 days and 7 days we have to give a gap where we can where there is the menstruation bleeding occurring at that point of time, and after from the day one we have to start the next pack. So this combined oral contraceptive pills is not just used in the treatment of the PCOD, it is also used as a treatment for the contraceptive. It is also used as a contraceptive. So when we use this pill, if by mistake, it is a tendency for everyone to miss the pills, like forget to take it on one day. So how do we do it? How do we take the next pill? So if there is a missing of if you have missed one pill, then you can take that pill on the next day. So that is like next day you take 2 pills. If there is a missing of the 2 pills, then we have to check whether it is you have missed the pill in first and second week or in the third or fourth week. If you have missed it in the first and the second week, then we have to take 2 pills on the next day. 2 pills each you have to take on the next 2 consecutive days. If it is missed on the third and the fourth days, you have to discard that pack and start the new pack. Okay, if there is a missing of if you have missed 3 pills in that in any week, then you have to discard the pack and you have to use the alternative contraceptive in these 2 conditions. Okay, next Next is this image where after you see this on your USG, and plus if you have a increase in, if there is an increase in the HCG level, we have to look for the history. What is the patient history? If she is on the IVF treatment, it is OHSS, that is ovarian hyperstimulation syndrome. If there is a history of the molar pregnancy in the past, we have to rule out the thecal luteal cyst. So what is molar pregnancy? In the molar pregnancy, there are two types of the molar pregnancy. It can be complete molar pregnancy or it can be partial molar pregnancy. What is complete molar pregnancy? Complete molar pregnancy is like a normal pregnancy itself, but there is no fetus in it. So what that mole contains, it has a normal phenotype like 46XX, 46XY. But in the partial, there is extra chromosomes are present, and these two condition is mainly from the paternal side. So the partial includes 69Xs and 69XXY or 69XYY. Okay. So this is about the molar pregnancy. Thank you.